Hi. On this video, I want to talk to you about the Practice Ready Assessment opportunity in Alberta, okay? So when we talk about the Practice Ready Assessment for family medicine in Alberta, there's a few things that you need to know. So number one, starting again with the exams that are needed, okay? You do need to have the MCCQE 1, okay? Now, the thing that is interesting about Alberta that is not possible for many of the other practice ready assessments is that they do accept the USMLEs as long as you have done all three steps, 1, 2, and 3, okay? So either you need to have the MCCQE 1 or you need to have the USMLEs, okay? And then that means step 1, 2, and 3, okay? That is number one. The second thing is that you also don't need NAC for Alberta, which is a great thing. As I said, BC also, you don't need it. You also don't need it in Alberta, okay? Which is really, really good. They will also consider candidates that don't have the permanent residency status, but of course it is a little bit more complicated, but if you have the permanent residency status, it's much easier for you to apply for any practice ready assessment, but Alberta might be an option if you don't have a permanent residency, okay? Now, they will also invite you to take the TDM. So they will give you an invitation once you pass the initial screening for you to sit the TDM, okay? Now, what is the currency of practice? So the currency of practice in Alberta is more strict than in BC. So in BC, if you remember, your currency of practice is 960 hours in the last 3 years, which is basically 6 months full time. In Alberta, you need to have practice for 1 year in the last 3 years. Now, something very interesting about Alberta is that there is no minimum time of independent practice, which means that you would be able to apply for the practice ready assessment if you were fresh out of a residency program, for example, okay? So there is no requirement of independent practice experience, but you must have practiced for 1 year in the last 3 years. But if that, for example, you did a medical school that has an internship and you completed that internship and then did 1 year of postgraduate training, or you did 2 years of program, or you did 2 years of family medicine residency, upon completion of that residency, you have 2 years only to apply for this if you're not doing any independent practice after the residency program. So basically, either it doesn't matter if it was residency or if you were practicing independently, you must have been practicing for 1 year in the last 3 years. And fellowship does not count for Alberta. So it has to be a residency program or independent practice experience. Alberta also does not recognize the time that you have worked as a licensed clinical assistant in Alberta or any other province as being experienced. So it doesn't break the gap, okay? Now, the downside of Alberta is that in terms of your postgraduate training, you also are required to have 2 years of training, okay? So just the internship will not give you a the opportunity to participate in the practice ready assessment program in Alberta. You do need to have 2 years of training, okay? So in summary, for the practice ready assessment in Alberta, you do require the MCCQE 1. You do not need the NAC. You need the TDM. Your currency of practice is 1 year in the last 3 years, and you need 2 years of postgraduate training so that you can be eligible. The things that are different from other provinces that are interesting is that you do not need the NAC and you do not need to have independent practice experience. Okay? So there's the perfect opportunity for internationally trained physicians that are exiting their residency program and didn't yet have the opportunity to practice independently. If you don't have independent practice experience, you are only able to participate in the Practice Ready Assessment program in Alberta if you do it within the first 2 years that you are out of practice or that you've completed your program, okay? So this is a very interesting option for, as I said, people that finish their residency and want to start working and they didn't have any independent practice experience after they finished the residency program, okay? So I will now talk about another license, and you should stay tuned for the next one and leave your comments below if you have any questions.